Division of Reproductive Endocrinology and Infertility at Johns Hopkins. Reproductive endocrinologists take care of people who are trying to have children but are having difficulty due to infertility. We also take care of women who have problems with hormones. I became a reproductive endocrinologist with my interest really starting as a medical student. I was really attracted to the idea that perhaps I could be helpful in helping people to have children who are having difficulty having children. For many people, having children is a really big part of their life goals, and I wanted to be able to help people who are having difficulty achieving that life goal. I also was attracted to technical advances that have happened in the field that have really made it possible for us to help people who perhaps in the past could have never conceived and carried a pregnancy. My research at this point has really focused on what we can do to help to make the pregnancy safe for the mother and for the child. So really focused on the outcomes and the health of the mother and the child. At Johns Hopkins, we offer a full range of fertility services, including treatments for infertility, fertility preservation, such as egg freezing and ovarian tissue freezing. We're also part of a larger community of physicians who really have expertise, a very broad range, breadth and depth of expertise in areas such as severe endometriosis, severe uterine fibroids, hormonal issues, medical endocrine issues, male infertility. So we're part of a big community, and I think that that team approach to fertility care is really something that sets us apart. With respect to philosophy of patient care, I think the biggest concept for me is individualization. I really try to first learn about as much as I can about my patient, the medical facts, but also their concerns and their particular preferences. Then I use medical knowledge that I've gained over the years and apply it to their situation. I like to present a range of options, but then also a clear recommendation and to help them guide through the process of their care. It doesn't always come up during the course of a consultation, but I think I'd really like people to know that I do have a fair amount of empathy and understanding for what it's like to have to go through infertility. I've been through a lot of this myself, and it's sometimes frustrating, and can't understand why, if I'm doing everything right, I'm still not pregnant. And so many things in life, if we just try harder, we take better care of ourselves, it works out, and it isn't always like that with pregnancy. So I really appreciate and I'm grateful for the opportunity that I have to care for my patients and to walk through this fertility journey together.